Well, there's been a big push for people to get their flu vaccine this year to help decipher between regular flu and coronavirus. But exactly who should get a shot and when is the best time? I spoke today with the Chief Quality Officer at Desert Regional Medical Center, Christine Langenwalter. Christine, thanks for joining us.
You're welcome. Thank you. Thank you for having us.
Obviously, the flu is not the same as coronavirus. So then why is it especially important this year still for people to get a flu shot?
You know, Peter, I've been asked that question a lot. And we even have a lot of healthcare workers here at the hospital that says, well, if I have to wear a mask, do I actually need a flu shot this year? And actually, CDC is recommending this year more than ever before, we need to get our flu shots to protect us not only from influenza, but also to do what we can to prevent the spread of influenza in our communities.
Is there still concern of a twindemic?
Yes, it's funny you should use that word. I have that in my notes as I was looking as well. There is a concern about a twindemic. COVID is a coronavirus. Influenza is a separate virus from the coronavirus, an influenza virus. And so both of them can cause different illnesses and viral syndromes. So we need to be cautious of both. Similarly, they cause the same kind of symptoms. You get kind of fever, chills, body aches, those types of things, but they're very different.
So who should get a flu shot? Everybody or specific people in particular?
Actually, everybody should get a flu shot if you're over 6 months of age, including pregnant patients. So our highest risk of patients are those that are over 65, those that have diabetes, those that have other things such as heart disease or lung disease. But anybody that's over the age of 6 months can get a flu vaccine.
When specifically should people get a flu shot? Is there a certain time of the year that it's most effective? And what about people who may have already gotten a flu shot? Do they need to get a booster?
So the CDC also recommends flu season for the United States of America goes from pretty much October through spring. You can get a flu shot. You'll see them out and about now in the drugstores and things. You can get them now. The best time to get it is probably mid to late September, October. That'll make sure that the immunity boosts and lasts all the way through the spring season.
And if people already got a flu shot a couple of months ago, do they need to get a booster shot or are they good for the rest of the year?
They should be good for the rest of the year. I would advise them to talk to their physician and see if a booster may be needed. That would be something that would be between them and their physician, and maybe based on their medical status, that may be certainly an option that they may need to consider.
How are things right now at Desert Regional with coronavirus?
Things with coronavirus right now are steady, but under really great control. I'm really proud of our team here at Desert. I have to say for the past week, we've had typically under 10 patients that are positive, which is really good news. We are hoping that through social distancing and through all of the precautions that everyone has taken over this last holiday, that we will not see a bump or incline. Typically, we're expecting from CDC recommendations that we may see an incline more towards November, December is what some people are estimating. But even if we have that, we are going to be ready, and that's why we want to encourage the community to get their flu vaccines. We want to try and decrease the number of flu admissions as much as possible.
All right. Christine, we appreciate your time. Thanks for joining us.
Thank you.